Ladies and gentlemen, boys and girls, thank you for your kind attention. This is continuing with our Life Without Fear little sequence here. So just a couple thoughts for today. I hear all the time, Dr. Mary and I hear all the time from our patients, they have so many questions. The purpose of these videos is to help inform and enlighten. And remember, we're not trying to be something that we're not. We realize that we're an alternative medical center. We offer an alternative to drugs and surgery. And that's the role that we're happy to play in the world of healthcare. So understand this. There's a lot of talk. There's a lot of talk about the immune system and about antibodies and about antigens and this antigenic response to the antibodies, etc. So I want to break this down a little bit for you guys today. This is not rocket science, but it is quite detailed. So hopefully we'll be successful in just getting a few points across today as we move forward. Some people have asked us, Doc, why if 99 point something percent of people are going to be fine with this, with COVID-19, then why are we so bent on getting and administering this vaccine? And I'm like, well, that's a great question. Let's talk while we're getting you adjusted. So they go face down and we talk. I've had this conversation so many times, we wanted to put it on the web so people could just click on it and move on. I want to talk to you about the difference between a mucous membrane and your bloodstream. Okay, because this is crucial that we understand this. One point today. We need to understand the difference between what is a mucous membrane. A mucous membrane is the lining of your nasopharynx, around your eyes, around your oral cavity, all the way through what's called the alimentary canal, all the way through to the other end. Your private parts, these are all covered in mucous membranes. And this is where normally our body interprets a foreign attacker. In this case, it's a virus, and just say that it's not COVID-19, but just say that it's a virus. Like 3 years ago, you went to a family gathering and two of you ended up being sick afterwards for like a 2-week period, and then you got better and you went back to work and it wasn't a problem. So just take your mind away from the fear of COVID right now. When you get something that touches your mucous membrane, that is how your body normally adapts to your environment and builds an antibody to that thing that we call an antigen. Okay, so just think you have, like there's Dr. John, he has a self. Anything that is non-self is a potential enemy. Now, in the case of eating a banana, that's not necessarily an enemy, but it's not a virus necessarily, right? So our body accepts certain things in, but other things it recognizes as the enemy, and therefore it attacks them. That is how the immune system works. Normally, we have an antigen that gets interpreted on a mucous membrane. The body has a mechanism internally to make antibodies against the antigen to kill it so that you can survive. That's pretty much how it works. One of the main problems that we have with modern day immunizations or vaccines is that they bypass that whole process and they bypass how the body normally makes antibodies because they're injecting through, in this case, your arm. And that thing, which isn't really a vaccine, it's a technology, gets into your bloodstream and your body doesn't have the same adaptive mechanism. By adaptive, I mean saving your life. This is how your body adapts to save your life so that you can live. So we bypass all the natural, when you inhale something into your lungs, when you breathe it into your nasal mucosa, when it's we call fecal oral transmission, when stuff that's down there shouldn't get into your mouth, but it does. Children picking their noses, all the gross stuff that we don't want to talk about, That's the normal transmission. We're bypassing all that, and at the end of the day, we don't get the immune response that we'd like. So this adds all the additives to the vaccines, including aluminum, thimerosal, you name it. We have a chart in our office, and we have people, sometimes they come in and they take a picture of it, and they're like, Doc, I had no idea that formaldehyde is in, oh yeah, it's in there. Or aborted fetal tissue is in the vaccines that I've had put into my children against the measles, mumps, and rubella, which aren't even life-threatening illnesses. So anyway, if you're going to understand the immune system, you've got to understand mucous membrane versus bloodstream. It's crucial, and these are the questions that we need to be asking. Why is a simple cut so important to clean and protect? We have a small cut on our finger, and it's prone to infection. We've done the same thing. We've bypassed through the skin into the bloodstream. Very dangerous to get infections in your blood. We have a patient I talked to recently, guys. This is the other point that we're going to make, and that'll be it for today. I want you to think about a timeline for me, because there's a principle of life, and I know this is going to sound so basic and fundamental, it's like, why did you even mention it? But I have to mention it because we don't think clearly about these things. There is nothing in this world that doesn't require time. I think I said that properly. Everything we do requires time. There isn't a McDonald's Happy Meal drive-through answer for a good, properly functioning immune system. Time is the essence. I want to give you an example and another example, and then we'll call it a day. This is the question. How long does it take a healthy person's immune system to make antibodies against a novel virus? Forget about COVID-19. I'm talking a virus from a couple years ago that wasn't this fear-mongered, dreaded virus. How long does it take if you have, like, say you've been tested for, COVID, but you were negative, but you also had sinusitis this year? Just think in general terms. How long does it take your body to make antibodies to a novel virus, or bacteria for that matter? The answer is it takes, if it's a new virus or bacteria, it takes 14 days from sensing it, interpreting it on a mucous membrane, to build the machinery necessary to build the specific antibodies to destroy or kill that thing. It takes 2 weeks. Now follow me, because you're going to know where I'm going, some of you already. You're sick for 3 days. On the 4th day, you get a visit to your Zoom internet with your doctor. You're like, listen, I've had this sore throat. I'm on day 4, doc. Well, listen, we're going to send you in a prescription for a Z-Pak, for erythromycin, for some sort of antibiotic. It's a 10-day protocol. You've already done the math, most of you. And in 10 days, are you better? Yes, because the antibiotics worked. Maybe. Or your body just needed the full 14 days to actually build the antibodies itself to fight for you. And this is something that some people never do. They never give their body a chance to fight. They have to nip it in the bud, but you can't cheat the immune system. Sometimes it just needs time to adapt, because then when you take the antibiotic, there's always a pro and a con to taking the antibiotic, which usually messes up your normal flora of your whole colonic floral system anyway. So then we have to rebuild that and start all over again. Had a patient who will rename nameless, who is involved in a major healthcare system, who is an expert in his field in respirators and helping people once they get on, if they're a COVID patient and they actually have to vent them. He's like, doc, and he says this to me, unprompted by the way, he says to me, it's like if we can just get them past day 14, they live. If we can't get them to day 14, they die. And it's not cut and dry, But as a general rule, they're desperately trying to get these people to day 14. What does that tell you? With what I just told you about how the immune system works. Look it up on DuckDuckGo. Google it. Ask your medical doctor, ask your pediatrician, how long does it take for a novel virus to be interpreted by your body to make a sufficient amount of antibodies to combat that thing? This is not my opinion. These are scientific facts. Guys, your body needs time. It needs to be well fed. The purpose of this, remember, this is life without fear. Your body has the potential to make antibodies against anything in the world. Anything. There is nothing out there that can beat you when your body is functioning properly. What is the push of the alternative medical healing arts? Chiropractic, acupuncture, homeopathy, naturopathy, all these different holistic medicines is to take care of the person first, to build a stronger person so that those viruses and bacteria don't even have a chance. Remember, life without fear. You don't need to be afraid. God made you stronger than a simple, tiny little microscopic thing. From me to you, I love you all. Share, like, ding the bell. You know what to do with this video. Send it to your family members who are afraid. Hopefully this helps. This whole series of Life Without Fear, guys, is going to be great for me. I don't know if it is for you, but I'm enjoying it. Have a good one. Until next time, this is Dr. John signing off.